So many incredible things that all of you just added to that, and so many points that I really want to elaborate on. The fact that doula services it's so different than what many of us were taught growing up. That initially you heard, oh, that's just for like people who are all the way out here, and you need to be in a hospital and you need to have a doctor. But I think we've almost kind of seen this switch where it has become, like you said, with social media, it's become a lot more accepted, but you also see the positive impact that having somebody who can vocally support you and to be that voice where we may be too intimidated to question a doctor or what they think is best for us, to have somebody stand right beside us and say, I know you as the person, not just as a patient. Would you agree with that at all?
Absolutely, and I'm going to echo what everyone said. I think, not to shameless plug, but our tagline at Moby Nurses is engage, educate, and empower, in that order, because for the exact same reason that everybody just mentioned, education leads to empowerment. There are so many people, one, who don't even know what perinatal support is and how important it is. They don't know their risk factors. They don't know going into a pregnancy, going into the hospital to give birth, they don't know their risks. And so having that support from the very beginning, leading up to the birth, is so, so important. And then also having that support postpartum, because a lot of times that's where bad things happen. People don't realize that. Having that support throughout the entire pregnancy and that wraparound support from a doula or from a perinatal support advocate is so, so important, and it can save lives.
It was a game changer for our family. Jessica Roach with Root Restoring Our Own Through Transformation was our doula, and it was the healthiest that Habiba had ever been. If you look at all her charts, because she came up with a nutrition plan for her, stayed on top of her, even post, when we looked at her numbers, she was still the healthiest that she had ever been. And my wife suffers from sickle cell, so it's already a higher risk pregnancy. And I think empowering us with the information that was needed. Jessica even also forced me to go to the doctor. It had been almost well too long before I had even went and had my physical. And she said, well, you're not moving forward until you go get your physical too. So it's about the whole entire family's health, and having those doula services absolutely gave me the empowerment in that room when they wanted to induce Habiba's pregnancy, but every time she had a contraction, Xavier's heart rate would drop to almost zero. And so because of what we had learned, and we knew we had a birth plan and all the things that we had been coached throughout the process, it clicked in my head that, well, if we induce, that's going to make contractions much more frequent and much more intense, therefore making his heart rate drop even more. And so I said, no, we're not going to do that. And I felt empowered in that moment, right, to say that. And that was a nurse who was recommending it. Then when the doctor came in, he was like, no, you were absolutely right.
Wow.
And I wouldn't have even suggested that.
But because you were there through the process and you had that education, you felt empowered to say, I am aware of what's happening and I feel good about moving in this direction.
Absolutely, and they were there posts for us too, right? And it's not a silver bullet, but it's one tool in the toolbox that we have to make sure that we look at.
I think there's a misconception also about doulas coming into the birthing space and sort of taking over. That's not the case at all. A doula is there to empower the client to speak up for themselves. And that's what's so important. A lot of patients, clients, they don't even know that they can say no to something as simple as, we want to induce you, for whatever the case may be. We had a client that was having it was our first client. She was having her 6th baby. She knew her body.
Yeah.
She knew when she was going to go into labor, and she truly did. She knew up to the date when she was going to go into labor, and that's what happened. Her doctors wanted to induce her for her blood pressures. Her blood pressures were only high in the office. Me and my doulas even went back and forth, because I'm on the clinical side, they're on this side, and we sort of had a back and forth. But at the end of the day, we educated her. We let her know this is everything. Here is the story. Here's the clinical picture. You make your decision. And she made her decision, and she did not go for her induction. Her water broke, and she had the birth that she wanted.
Wow.
So that's what a doula in and of itself, that's what it does. It empowers the patient to make their own decisions and to do what they think is best for their body, because they know.
I just wanted to add to this that doulas are an incredibly important part of a portfolio of caregivers during a pregnancy. But one of the providers that often gets lost in the conversation are midwives and midwifery care. And midwifery care really does have an impact on outcomes. We see it abroad, and we can see it here at home. And so looking at how we develop a strong portfolio of birthing workers in the workforce is a really important part of wrapping ourselves around this issue. So that spans from doulas, that means midwives, that means labor and delivery nurses, and anyone that comes in contact with that birthing family needs to be able to relate to that birthing family. And so I think we have a responsibility, and it certainly falls within Celebrate One's responsibility to build the portfolio of birth workers in Central Ohio.